Good evening. I'm Dr. Vemuri S.Murthy. I'm truly honored to be part of this grand celebration of Red Saree event today. I thank the organizers of this function, the founder and CEO, Dr. Sadayappan, Ms. Gurusamy, and other leaders for your kind invitation. As I understand, Red Saree is an emerging movement to promote healthcare awareness among South Asian communities in the United States with an impressive track record. As a resuscitation educator and trainer, also associated with the American Heart Association in different capacities, both in the United States and India for some time, I'm appreciative of your efforts with a particular focus on cardiovascular health. In this day and age of evidence-based global medical practices, it is important to know why the South Asian communities need tailor-made strategies to address their health-related issues. South Asians have a 4 times greater risk of heart disease than the general population and have a greater chance of having a heart attack before 50 years of age. Heart attacks strike South Asian men and women at younger ages, and these attacks are more dangerous compared to any other ethnic group. Almost 1 in 3 in this group will die from heart disease before 65 years of age. In India, cardiovascular disease remains the #1 cause of death. One study found that the South Asians developed heart disease 10 years earlier than other groups. If we look at the traditional risk factor assessment, South Asians tend to be smokers, and the typical diet tends to be high in sugar, refined grains, and fatty foods. An alarmingly high number of South Asians appear to be insulin resistant, a condition in which the body doesn't process insulin efficiently. They are more prone to cardiovascular events. The body mass index in South Asians often falls into thin fat syndrome. People may have an acceptable body mass index, but they also carry more of their weight in their abdomen, and their visceral fat leads to a cardiovascular event. More than 1/3 of South Asian men and 17% of South Asian women have metabolic syndrome, which includes high blood pressure, high blood sugar levels, excess fat around the waist, and abnormal cholesterol levels that increase the risk of heart disease, stroke, and diabetes. The MASALA study, an acronym for Mediators of Atherosclerosis in South Asians Living in America, is a pioneering study of South Asians in this regard. One of the clues to explain some of the health disparities from this study is the risk factor of having a lot of visceral fat in the abdominal area, liver, and around the heart. South Asians have a tendency for smaller luminal diameters of the coronary arteries, higher grade occlusions with multivessel disease. Cardiac arrest happens when the heart stops beating. Some 350,000 cases occur each year outside of a hospital in the United States, and the survival rate is less than 12%. Bystander CPR can double or triple the chances of survival. There is not enough data about the exact prevalence of sudden cardiac arrest among South Asians in the United States or Indians in India. Given the fact that South Asians have more cardiovascular problems, we can presume that the incidence of sudden cardiac arrest might be higher than among general population. In a recent pilot regional cardiac arrest registry study in the state of Telangana in India that I was involved with, we have recognized the importance of raising community awareness to seek early emergency medical help to increase survival after heart attacks and sudden cardiac arrests. One important observation. We know that women in general have a different pattern of cardiac symptoms. They don't seek emergency medical care as much as men do and receive less treatment for the same indication in both primary care and secondary prevention. Having addressed the issues unique to the South Asians, here are some of the recommendations to enhance their cardiovascular health. Prevention through awareness via community education about heart disease, stroke, sudden cardiac arrest, hypertension, and diabetes. Targeted training for programs such as community hands-only CPR. Early diagnosis exemplified by community screenings and personal counselings. And lastly, timely interventions. American Heart Association advocates life's simple 7: stop smoking, eat better, get active, lose weight, manage blood pressure, control cholesterol, and reduce blood sugar. We also need to encourage mental health promoting interventions with individualized holistic approach. Finally, I commend you for all you do to promote the health of the South Asians living in the United States. And here is a quotation by Thomas Edison. The doctor of the future will give no medicine, but will instruct his patients in care of the human frame, in diet, and in the cause and prevention of disease. Thank you.